Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to the 31st episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we're excited to be interviewing Dr. Matthew Benson.
So, a little bit about Dr. Matthew Benson. He's a clinician scientist in the Department of Ophthalmology and Visual Sciences at the University of Alberta. He specializes in ocular genetics and adult strabismus, and he runs a translational research lab that investigates disease mechanisms and inherited retinal disorders.
He completed his medical school and ophthalmology residency training at the University of Alberta, and then he went on to complete a clinical fellowship in ocular genetics at the National Eye Institute at the National Institutes of Health. In addition to his medical and surgical practices and research interests, he is involved in mentoring medical students, graduate students, residents, and fellows. So without further ado, we would love to introduce Dr. Benson.
Thanks so much, Danielle and Emaan, for having me join your podcast.
Thank you for joining us. We know that you have such a busy schedule, so we really appreciate you joining us today. We'll jump right into the first question, and we ask all of our guests this question. So do you mind just starting off by talking a bit about your journey to ophthalmology?
Sure. Yeah, so my journey to ophthalmology started from fairly early on in medical school. Based from my basic science experience when I was an undergrad student, I kind of had spent a few summers in a cell biology lab. Kind of knew that I liked fine detail work. I liked to work underneath a microscope. And so that was kind of a couple of the things that drew me towards a specialty like ophthalmology early on. And then also I was interested in a specialty that combined both medical and surgical aspects. I liked kind of doing things with my hands, but then also kind of thinking about things and seeing patients in the clinic as well. And so I thought ophthalmology would be something that would combine both of those aspects nicely. We started learning about ophthalmology, I think it was in second year of medical school. And I think that was really what solidified it, is that I really enjoyed learning about the content. I did about most of the areas of medicine, but especially ophthalmology. It combines some of my interests like mathematics and physics with optical principles. I think that's even going back to, high school even. And then afterwards, learning even about things like phototransduction and really like cell biology basic mechanisms. And so I kind of combined a number of my interests. And so I thought, I think I'm going to go for this and give it a shot. I did some shadowing when I was a second year med student as well, just in the clinic. And I found that, the clinic flow was really nice. And all of the ophthalmologists that I worked with were exceptional. And I got to know the residents as well during that time. And then I pursued some research opportunities as well. The first one was in between first and second year of medical school. I spent 4 months in Dr. Orden Lehman's lab. He's a clinician-scientist here at the University of Alberta as well, and a glaucoma specialist. And it was, I don't know if I was necessarily looking for a basic science project, but I think just my natural interest in it was something that drew me towards that. And I knew I wanted to do something in the ophthalmology space as well. And I just really enjoyed my time working with him and working with his lab. And then I also spent some time with Dr. Ian McDonald, who's a clinician scientist as well in ophthalmology here at the University of Alberta and specializes in genetic eye diseases. And it's kind of similar to what I'm doing now today. And so just the value of the mentors that I had, even as a med student, fortunate to work with, really paved the way for me enjoying the field of ophthalmology and kind of seeing myself doing that as well. And then when I was a third and fourth year medical student, that's when I spent time in electives and kind of traveled across the country, seeing different programs, meeting residents, and learning a bit about the different programs out there. And then come fourth year, I was fortunate enough to match to ophthalmology and was able to stay at the University of Alberta. And that's kind of what brings me to where I am today after ophthalmology residency and fellowship.
Oh, that's awesome. I really appreciate when the stories tie in a lot of an individual's previous interests into the specialty, because it goes to show ophthalmology is so unique. Like, you can go through the research avenue and pursue research when you're in ophthalmology. If that's something you're not interested in at all, like, that's also okay. So that's wonderful. And also agree, like, mentors for me have also been a huge part of my journey to enjoying ophthalmology. So thank you. You kind of touched on this, so I'm excited to hear more about it. But could you talk a little bit more about your fellowship in ophthalmic genetics And, this is something that I personally haven't heard much about. And I think that med students and residents in general don't have much exposure to. So maybe what it's like, what a day-to-day looks like in your practice and, through research as well.
Yeah, certainly. Yeah. And when I first started residency, I hadn't heard about ocular genetics as well as the specialty. And I kind of, just to backtrack a little bit, I'd mentioned that I was interested in medical and surgical specialty because you kind of can do a bit of everything and really take care of the eye itself. But as soon as you dive into ophthalmology, you realize there's all these subspecialties. And, I can't do glaucoma. I maybe learned a little bit about glaucoma surgery, but I'm not a glaucoma specialist. I'm not a retina specialist. So it even becomes more subspecialized the more you kind of dive into it. But it was mainly through my research experience working with people like Dr. Emaan and Dr. McDonald that I kind of learned a little bit about the clinician-scientist route, and it merged some of my interests with being in a lab, working in the fundamental science lab and basic science lab with some of the clinical aspects of ophthalmology. And so seeing that they have a practice that incorporates a lot of genetic aspects, I thought, maybe I'll look a bit more into ophthalmic genetics. And it's relatively recently that it's become a specialty, and it's not offered in that many places. I think in Canada, Toronto does offer an ophthalmic genetics fellowship. And then there's a number of places in the States and probably a few overseas as well. But it was really kind of Dr. McDonald that had pushed me in this direction and guided me in this direction because he specialized in inherited eye diseases, and this was kind of really something I became very interested in throughout residency and thought, it'd be helpful to get some formal genetics training as well, because going through medical school and apart from, working with people that are doing this in ophthalmology, you don't get that much exposure to inherited eye disease for sure not, and even basic medical genetics principles. So I thought I would pursue an ocular genetics fellowship. It was a one-year fellowship, and it was a clinical fellowship at the National Eye Institute, at the National Institutes of Health. This is just outside of Washington, D.C., and it was an absolutely fantastic experience. It was a lot of hard work, but I really enjoyed my time there working with world experts in the area, and it's a relatively small community, and so you get to know people fairly well. So I was exposed to all sorts of diseases like congenital malformations, metabolic diseases, inherited retinal degenerations, working with medical retina fellows, uveitis fellows as well. I didn't have any surgical exposure during that 1 year, and I know that that's something that people consider when they're thinking about fellowships as well. I was fortunate to get a lot of strabismus training during residencies. That's my surgery that I do now. But for that year, it was primarily just clinical. One of the nice aspects of the fellowship too was that I had an opportunity to mentor a student who just finished her undergraduate degree, and she was interested in medical school and was going to pursue some additional years of research. And so during her first year of training, she was working with me in a lab at the NIH, and I was fortunate to work with Rob Huffnagel, who is a clinician scientist there, who's medical genetics trained. And I was kind of mentoring her, but then also learning some of the lab techniques that I ultimately use currently today. So it was a bit of kind of basic science, still kind of was carried along with me even during my fellowship. And it was a very amazing opportunity. And Washington, D.C. is a super nice city to live in too. I hadn't really spent a whole lot of time in the U.S., but it was a very, very rewarding opportunity to spend a year there. And now basically kind of transitioning from there to what I do today, it was really seamless because you feel like you've kind of got a solid understanding of medical genetics. There was a full year-long course that we did as well, learning some of the kind of medical genetics principles, understanding how to interpret genetic test results and that sort of thing. And that kind of led into what I do today. So I split my time about 50-50 between the clinic and then between the basic science lab. So I have a translational research lab at the University of Alberta. I'm an assistant professor in the Department of Ophthalmology and Visual Sciences, and I supervise a few graduate students, which I think is super cool. There's a master's student that I work with, two master's students, one just started. And then an MD PhD student who I co-supervise with another PI. Also supervise undergraduate project students, summer students. So definitely maintain kind of my interest in basic science, and my research interests are in understanding disease mechanisms in inherited retinal diseases. This is kind of patients that I see in the clinic. They have generally mutations in specific genes that cause often progressive vision loss. And there's not much in the way for treatment options for these patients, unfortunately, except for very few conditions. And so I'm trying to understand a little bit about what the gene is causing and how the gene is causing vision problems in these patients. And so what I do is I collect patient samples. They're enrolled in a study. I usually collect either a blood sample, or you can take a tissue biopsy or skin biopsy, and we reprogram those cells into stem cells, and then we differentiate those cells into retinal cells, so we can study the patient's specific phenotype and disease-causing mutation in a retinal cell type. It's difficult to kind of biopsy the retina, of course, and study it that way. So this is sort of one way to work around it, and sort of one of the up-and-coming personalized medicine approaches to research, and that's kind of what my research interests are. From a clinical standpoint, I usually spend 2 days a week in the clinic. One of those clinic days is seeing strictly ocular genetics patients, kind of all sorts of pathology from corneal dystrophies to retinal dystrophies. I help families kind of navigate being diagnosed with a genetic condition, offering genetic testing, and kind of follow up as well. And then my second day of the week is generally adult strabismus. And so that's where I'm kind of medical surgical management of strab patients. I also do on-call as well, which is maybe once a month or so. And then I'm in the operating room once every couple of weeks too, and it just falls on sometimes a different day. So I have to be a little bit flexible with my time there.
Well, thank you so much for sharing all of that. Like Danielle mentioned, I feel like ophthalmology is such a niche specialty that we barely learn about it in medical school. And so learning about such a niche subspecialty is truly something that we don't get to hear about much. So it's really helpful for myself, Danielle, and all of the students listening. So thank you so much. And you mentioned it a bit earlier, but you work with many medical students and residents, it seems like, and we do have a lot of listeners that are medical students and residents. Do you have any advice for these students that are maybe interested in pursuing research options within ophthalmology or within medicine in general, or just any advice that you would have for students kind of making their way through medical school or residency?
Oh, for sure. Yeah, I often get a question about how soon should I be involved in research if I'm really interested in ophthalmology. And I'd say if you're thinking about ophthalmology, I think research is a great way to learn more about the specialty. You work with individuals kind of that are practicing as ophthalmologists. You also get to learn kind of who's part of the department and learn the residents and fellows as well. It's a little bit challenging to be honest at the U of A, at least. Maybe different medical schools are slightly different, but for obtaining a research project, I know we get lots of requests from lots of students, and sometimes it's difficult finding projects for everybody. We're currently working on a system where we will have something on the website where we kind of list who has active ongoing projects. So hopefully that eases the burden and makes it easier for people to find projects. But I would just encourage students or residents as well to kind of find a mentor who is doing something that you're interested in, whether that's basic science or a clinical research project. It's always good to come in, I think, having some idea of something you'd like to work on. It's sometimes I will get emails or requests from someone who's not sure what they want to do, but just wants to do research, which is completely fine. And some people aren't sure what they'd like to do. But I think having a little bit of direction in terms of what kind of project you'd like to work on is helpful. Different departments will have kind of a list of people who are either academic or clinical or a bit of both. And I think it's fine just to reach out, to someone with their emails there, or if one of the residents who's involved in a project, or the chief residents. Those are often good starting points. And I find that there's usually someone who can direct you to a research project going on, because most ophthalmology departments, I think probably all of them across Canada, have different research projects on the go and are always looking for people who are interested in helping out. So those are probably good places to start.
Yeah, that's very helpful. And I just kind of have a follow-up question about research and, integrating research with your practice. Is this something that you think that individuals should know going in to residency, or do you think that there's room to kind of explore that throughout?
Yeah, it's a very good question. And although I had opportunities to work with clinician-scientists as a med student, it wasn't actually my plan when I was a resident to ultimately do that. I'm from a kind of a smaller community, Red Deer, which is just in between Edmonton and Calgary. And I was kind of thinking, I'll probably end up as a community ophthalmologist. And that was sort of what my goal was, and do comprehensive ophthalmology. But I'd always had this interest in basic science. I didn't think I would go down that route, but just, with the opportunity that residency offers you and the mentors that you meet along the way, it kind of just, guided me in this direction that I'm very happy with. But I would say that you don't necessarily have to have a solid plan for, how you'd like to incorporate research throughout. And in my case, I ended up doing 6-year residency. So I took an additional year to do a graduate program, essentially like a Master of Science degree. It ended up being I was enrolled in the program for a couple of years, but then I took an additional year to really focus on that. And so that just came out of being a resident, meeting people, seeing, being open to different opportunities and seeing what I was interested in. And that kind of guided me down that direction. So you don't need to come in from day one, necessarily with the PhD, unless you're certain that's what you want to do. But I think a lot of the residency programs, probably most of them, are flexible in terms of helping you find out what you'd like to do too. So if it means spending an additional year or a couple of years in a clinician investigator program or PhD program or a Master of Science program, I'm sure most of the departments across the country would be, accommodating students to be interested in exploring very personalized learning styles.
That's amazing and very reassuring to hear. I'm sure for many students that find that you need to plan every last thing. And so it's really nice to see that you kind of found your path along the way and everything worked out. And it seems like you were able to integrate a lot of your interests as well. That started a lot earlier. So that's awesome to see. Thank you. And with that, we've kind of wrapped up our ophthalmology and academic related questions. And so as our listeners know, now we move into our Would You Rather segment to get to know you a little bit better. And so I'll start off. So our first question is, would you rather have a pause or a rewind button in your life?
Oh, that's a good question. I'd probably rather have a pause button at this point. I think, there's always times where you wish you could go back and kind of adjust what's happened. But for me, I kind of feel like, you can learn from those opportunities, move forward, pause, kind of think about what's happened and learn from them and then move on. And also just things are very hectic, trying to balance clinical research and surgical things, that I think the pause would be more helpful for me at this point too. So I think I'd choose the pause button.
And it's also nice to take a moment and appreciate things. I think in the busy world we live in, it's definitely more challenging to do that. And then my question is, would you rather listen to your least favorite song on a loop for an entire year or never listen to music at all for a year?
That's a tricky question too. Probably listen to my least favorite song, because I think over time I probably would get accustomed to it and would kind of tune it out. And then hopefully that would allow me time to listen to things I do like to listen to too. I find that music for me is quite relaxing. I don't play any instruments or anything like that, but I do have, different genres of music that I listen to that kind of helps me stay grounded and relax as well. So I'd probably choose that.
Maybe at some point the least favorite song would relax you. Who knows?
Yeah, exactly. Potentially. It'll become the new OR playlist song.
Yeah, exactly. So with that, we've kind of wrapped up our episode. And so I just want to say thank you so much for joining us. And to our listeners, thank you so much for listening to this episode of Seeing Clearly, which is our pre-clerkship guide to all things ophthalmology. So to stay caught up with everything else iCurriculum is doing, be sure to check out our website at www.icurriculum.com and follow us on Instagram at iCurriculum. Thank you again so much, Dr. Benson, for joining us today.
Thanks so much for having me on your podcast.